Hi there, good afternoon. Dr. Amy Killen here. Today's subject on this little rant of mine is COVID-19 testing. I would like to convince you, to convince the powers that be, that we need to have home testing for COVID-19 right now. Really, we're pretty smart. As a population, we can figure out how to put a little bit of blood on a little piece of paper, and we can watch it, and we can look at two different lines and see if they're positive or negative. Or we can put a big Q-tip up our nose and put it in a thing and send it back. Now, this is not my area of expertise. However, yesterday I had a doctor friend of mine send me some information about a place that I could order some serology testing for COVID-19. So I started sort of diving into the research on this and looking at different ways we test for COVID-19. The serology testing is using antibodies that you develop to the virus. So it's checking for your antibodies to the virus. And there's an acute phase where we look at IgM antibodies, and there's the later phase after you clear the illness where we look at IgG antibodies. All of that is less important than the idea that these antibody tests can be done at home using a single drop of blood in about 10 minutes for about $20. And they're available right now. There are a lot of companies out there that can do this right now. I ordered some of these test kits. I'm going to have them at home. And if my family or my friends get ill, I'm going to be able to administer these tests. And as I was ordering these test kits, I was thinking to myself, why doesn't everybody, all of you guys out there, why don't we all have the ability to order these home tests for surveillance? Now, when I talk about surveillance, these tests may not be as good as the PCR test, the polymerase chain reaction tests, which are the tests that are looking for evidence of the virus itself. The tests I'm talking about, the serology tests, which look for antibodies to the virus, are not quite as good in general as the PCR tests. However, the tests I'm talking about are fast, cheap, and just require a drop of blood. So they're easy to do in one's home. We talk about using these tests for surveillance because that's what we're trying to do. We really need to know, in general, out in the world, how many people in this community have this virus. In general, how many people in this community have this virus? Because we honestly have no freaking idea right now. We have no idea. All we know are the ones who are going to the hospital that are meeting the criteria, that are sick enough to get tested. And then we know if they're positive or negative. I've had two different people, medical providers in my practice alone in the last 2 weeks who have come down with COVID-19 symptoms, who've tried to get testing, who know the system, who jumped through all the hoops, and they weren't able to get testing. And so they're home on quarantine like everybody else who has symptoms. But we're never going to understand what's going on with this virus and how deadly it really is and how prevalent it really is if we can't do testing at home. Now, there are several companies out there who have been working for this. Some of them have gotten shut down or at least got warning letters to stop the home testing thing. So Everlywell was one of them, a company called Nurx was one of them, a company called Carbon Health developed COVID-19 tests. Some of them were PCR tests, some of them were the serology tests that basically had these kits so that patients could do testing at home and then either processing at home as well or processing in the lab. But the FDA came out and said, no home testing. One of the other companies that's out there right now is called Skinwell, and I'm interested in Skinwell because they licensed a test from a company called Innovita in China. Though this company has been doing these serology tests in China for a long time. They tested a ton of people. They have lots of validated data. So the test is a good test. Now, in China, they did not do this test at home. They did it in a doctor's office. However, the culture here in the US is a little bit different. Most of us have done these kinds of tests at home. We've done 23andMe, or we've been doing pregnancy tests for like a gazillion years. So we know how to poke our finger, put a little blood on something, watch the lines move, and say yes or no. So the Skinwell test, they have the test. It's a validated test. It's been used in China for a long time. It's a blood spot test. It's super fast, 10-minute test. You could do it in your own home, very inexpensive. And they're still saying it'll be at least 6 to 8 weeks before the FDA potentially gives them approval to use this test more widespread. So my plea to anyone listening who has any powers in this matter, which maybe none of you do, I don't know, is let's really work hard to get these tests out to the people who need them. I'm talking about the people who are mild to moderately sick or asymptomatic. Using tests to scan asymptomatic populations would be an amazing way to see who are these viral vectors walking around spreading the virus. Obviously, if you have severe symptoms, you need to go in to see your healthcare provider, go to the hospital. You can get the more advanced PCR testing done that's a little bit more reliable. But for the general Joe Schmo that's just out there, like walking around, coughing and spreading their touches everywhere, I think it would be really helpful to have these tests available. And for $20 each, there's no reason that we don't. So that's the end of my rant and the end of my little lesson on COVID-19 testing. Thank you guys so much for listening. Please stay home, stay safe, and most importantly, maybe stay sane as we get through this together.